24.1. Match the two parts of the sentences look and EB and see a question to help you. Number 1. 1988 saw the UK launch of live Autónoma. Letter D. Motherless moms and rubella MMR vaccines. 2. Chickenpox varicella is a common infection. Letter A. Disease of childhood. 3. Rabies has an incubation. Letter A. Period ranging from 4 days to many months. 4. The patient remained febrile. Letter H. With peaks of temperature of 39.5 degrees Celsius. 5. He was admitted with a 4-day history or influenza-type symptoms or fever with letter B, visual malaria and general malaria. 6. Quite a proportion of patients who recover from the hepatitis B, letter C, become carriers of the virus. 7. The central part of Africa is in the midst of an epidemic, letter F, of AIDS. 8. Measles, rubella, isthmus, letter D, infection during the caudal stage. 9. Lyme disease is caused by transmission, letter G, of the birth ferry from animals to man being oxylytic. 10. PUO stand off, letter E percy of in all nuts originating. 24.2. Complete the case report of the patient in E, a portion look, and E, B, and C, a portion to help you. Case 45. On examination, he looked on while his pulse rate was 100 minutes. He had a pulse. Sleeping, the combination of fever and vigor in patient who has recently returned. For Africa, a strange subject a diagnosis of malaria. The incubation period usually for 10 or 14 days in case the patient admit he has not been taken. Regularly, the diagnosis has confirmed by the presence of parasites in this blood field. Complete the sentences look and EB and C option to help you. Number 1. An infection with can be treatment, successful with antibiotics curable. 2. Another word from an epidemic is outbreak. 3. Bacteria and virus access lakes, examples of microorganisms. 4. Someone whose temperature is normal is fever thyroxine. 5. The common infection with a spin-borne virus in nose is glandular fever. 25.1. Complete the table with words for an C, D, and E opposition. Noun adjective. Affected, affected. Anxious, anxious. Behavior, behavioral. Dementia, dement. Distress, distressed. Swiss, Switzerland. 25.2. Made word combination using a word from its box to words can be used to look at B, C, and E option to help you. Behavioral syndrome, eating disorder, major depression, mental disturbance, personality disorder, physiomotor emphasis, sleep disorders, sorbus, retardation. 25.3. Complete the sentences look and E, C, D, and E option to help you. 1. The way a person behaves is his or her behavior. 2. A persistent emotional state is a mood. 3. A sudden attack of aphasia is a panic attack. 4. Therefore, a dementia associated with brain is called symptom dementia. 5. A disorder which not associated with particle change is functional. 6. An idiot which forces the patient to repeat unnecessary action is a compulsion. 25.4. What symptoms of depression was this patient suffering for? Look and see a patient to help you. Case 441. A 56-year-old woman present to her GP complaining and crying stated over the past few months. She has lost interest in most things. She was sleeping poorly and tended to make up early, but then in and to see the alternatives. She was 30 as was passing urine more than often. She was eating normally and her reading was steady. Tiredness, fatigue, expanded poly, insomnia, loss of interpreter. 26.1. Complete the table with words for an EV and C oppositions. After the norms: blindness, consciousness, deafness, diseaseness, numbness, lean-headedness, understandest. 26.2. Mid-words combination using a words from Xbox, look, and EB and C option to help you. Double vision, epileptic fit, prodromal, attack, syncope, incontinence, urinary, equate, visual, equate. 26.3. A doctor is trying to determine the cause of loss of consequence in a 52 years old man. Complete the doctor question, look and see a portion of the table in 26.1 about to help you. Did you lose consciousness suddenly or readily? Did you get the rating of this attack? What were you doing before you passed out? Were you working or under any stress at the time? Did you feel disease or lightheaded before the attack? Did you lose control of your bladder? Did your wife notice any insecurity overall while you were anxious? 27.1. Complete the table with the words from an be opposition. Noun, adjective. Abscess, absent. Diminution, diminished. Flaccidity, flaccid. Splancy, spastic. Wastic, wasted. 27.2. A doctor is given instruction to patient during examination of the motor system. Identify what the doctor is asking in its case. Look and E option to help you. 1. I would like you to relax and just going to move your arm up and down musculus tone. 2. Can I see your hands? Musculus big and possibly vertebral musculus. 4. Can you touch my fingers with your hands that touch your nose? Good. Now, do you this again with your eyes closed. Coordination. 27.3. Complete the synthesis. Look at EV and C option on that table in the 27.1 about to help you. 1. If flaccid hot drop slips to front a right angle with the wrist. 2. Breasts relax or relaxes that are stronger than normal. 3. Musculus braiding means the musculus is reducing its bulk. 4. Attic is from imbrics or halberd. 5. A K is often used to test the plantar repose. 6. His coordination was poor. He could not perform rapid alternative move. 7. Attempt to relax hands to use it to test relaxes. 8. When something dimension is less than normal. 27.4. A patient abroad, E1, her name is spoken, she opens her eyes, she Dr. answered. 28.1. Complete the table with words for an E, B, and C opposition and relaxed words. Verb, non-adjective. Curricula, curative. Sex, section. Roll, broth, roaring. Invade, invasion, invasive. Obstruct, obstruction, obstructive. Palate, palation, palpable. Palpitate, palpitation, palpable. As breath, as breath, as breathing. As swell, as swim, as swelling, as swollen. 28.2. The notes below are about the passion described in the abortion used then to put the sentences in one and nine in the correct order to make that next paragraph of the case. Use appendicitis to one page 20 if you next help with the ad behavior. When CNS NAD examination of the central nervous system was normal. 5. Up means palpable 3 centimeters below all locus meaning. Of abdominal examination, there was a mass palpable 3 centimeters below the left costal meaning. 4. CBS nuts or S nod. His cardiovascular and respiratory system we normal. 8. B100 mean regular, B112 60. His pulse rate was 100 minute regular and blood pressure 112 60. 2. 7. Nose 2 centimeters in diameter, pulpal in hot, a lot and irregular areas. There were a large lymph nodes in both axillaries and in equal areas. 3. A smooth field 3.4 centimeters maze in our operation force. There was a smooth field 3.4 centimeters mass is the right supravascular fossa. 6. A weak 37.8 radial Celsius. On examination, his temperature was 37.8 radial Celsius. 28.3. Complete the sentences look and E, B, and C opposition to help you. 1. The standard spread of tumoral cells is known as metastasis. 2. Many symptoms of cancer, such as differently slowing, are due to obstruction. 3. The opposite of painful is painless. 4. A million herpes cell and cancer. 5. Tumors which do not imbibe of metastasis are beginning. 6. Secondary humidity are those which resulting from the spread of primary. 7. If occurs is not possible, pressure temperatures should be given. 8. A palpable liver surgeon metastasis.